Welcome to E3 Rehab. I'm Marc Surdyka, Doctor of Physical Therapy. I'm joined by Jennifer Carr, Fellow Doctor of Physical Therapy, Orthopedic and Pelvic Floor Specialist, and mother of two boys. We're inside Origin Physical Therapy, where Jen works, and today she's going to teach you everything you want to know about pelvic floor rehab and exercises. So Jen, let's start with, what is the pelvic floor and what is its function?
The pelvic floor is a bowl of muscles that lives at the floor of the pelvis. It has 5 main functions. The first function is support. It supports your internal organs. I'm going to take out a few organs, the bladder that I'm taking out, vagina and the uterus, and the rectum also supports your intestines and other organs as well. It's like the floor of the core. It also has a sphincteric support. So right here, there's a little hole where your urethra basically sends pee out of this hole. And there's a sphincter muscle that lives there. And there's also another sphincter muscle here. So it has a sphincteric support. These are kind of like beer cozy muscles that help provide closure and hold things in. It also has a sump pump function, which basically means it kind of helps move fluid in the body. It also has a sexual function, which helps provide blood flow and sexual arousal and pleasure. And this is vaginal anatomy. And then it also has a synergistic function. So this bowl of muscles, of which there are many, there are 3 layers, and I'll talk about those in a second. They work with other muscles to do their job. So they work very closely with the diaphragm, which lives underneath your rib cage, your abdominal muscles, and your back muscles. It's a complex system, and they all work together to help you move. So you can see here, you can see layer 1 on this model. There's 4 main muscles here that help provide closure and sexual function. There's also a layer 2 that's in between layers 1 and 3, which helps, those muscles mostly help provide support around the urethra and help keep pee in, but also have some other supportive function there too. And then we have our deepest layer, which is also called the deep perineal pouch. It lives in here, and you can see the muscle slings from the front at the pubic bone all the way to the back where the coccyx is. And so the muscle that's down the center that goes from the front to the back, we call that the pubococcygeus. It can be broken up into the puborectalis, which swoops around the rectum. It's really important for continence and bowel movements. And then we have the pubovaginalis as well. And then we have muscle off to the side, which is your iliococcygeus, because it goes from this part of the pelvis called your ilium, and it goes to the coccyx. And those two together are called the levator ani. They help lift the anus. And then we also have the coccygeus or ischiococcygeus in the back. Sits on top of this ligament, can be a culprit of tailbone pain sometimes. But all of these really work together to help provide support in all those 5 functions that I mentioned. If you see a pelvic floor PT, they might do a pelvic floor examination. And that can look like a couple of different things. So we can look at these muscles through your clothes. If you have clothes on, you can find this sit bone here or your ischial tuberosity, and you can feel this muscle group here. And you can feel it when it contracts, when it lifts and contracts, as it relaxes, and as it bulges. You can also feel the tailbone, and you can feel things move. That therapist might also say it might be indicated to have an internal examination. And that would involve a gloved, lubricated finger, and you can insert vaginally, and you can also insert rectally to look at these muscles.
On the flip side of that, what is meant by pelvic floor dysfunction? Like, what are common symptoms and issues that individuals deal with?
If someone has pelvic floor dysfunction, they might present with urinary incontinence. So leaking urine when they don't want to be leaking urine. So sometimes that can happen with like a cough or a sneeze or laughing or picking up something heavy. There's a lot of muscles that help hold that pee in. So it could present, that could be one of many things. It could also be gas or fecal incontinence. So someone losing control of their bowels or not able to control gas when they want to, or just sort of not being aware of it, but it can just kind of happen, and it ends up in your underwear. So that's something that it usually involves the pelvic floor. It can also be sexual dysfunction. So someone could have pain with sex. Someone could have not be experiencing pleasure when they have sex, or they could not be able to have vaginal penetration because it feels like they're hitting a wall. And often there's a pelvic floor dysfunction involved with that. It can be pain in this area, pain in this whole area that you sit on. Sometimes it's the skin, but often when the skin hurts, it can also cause the muscles to guard and become part of the problem too. It can also present like, oh, I feel like something's falling out and I have to push it back in, or things feel heavy. So people might experience feelings of heaviness, and that can be pelvic floor dysfunction. It can also manifest as hip or back pain. And one muscle I forgot to describe previously is this muscle called the obturator internus. It's a pelvic wall muscle, but you can find it right here. And it takes a big 90-degree turn, and it's a hip external rotator. So I don't have a femur here, but it attaches to the femur. And that can be a big driver of hip pain. And so sometimes if a pelvic floor physical therapist was to do an exam, they might poke on a muscle and that person might say, now that's my hip pain that I've been looking for. So these can absolutely cause pain other places too. Constipation or difficulty emptying might also be pelvic floor dysfunction. So having difficulty getting your bowels out, or even difficulty getting pee out, feeling like you can't completely empty, is often pelvic floor dysfunction.
Now let's talk pelvic floor exercises, starting with the most common option, Kegels. What are they? How do you perform them? And why might someone perform them?
A Kegel is a pelvic floor muscle contraction. So it's all of these layers of muscles working together to close and lift. So you can think of it like this bowl, maybe becoming more like a plate. So the first thing people often feel familiar with engaging this muscle group is thinking about like toileting behaviors or stopping either urine or feces from coming out. So if you think about stopping the urine from coming out, that might bias the front of the pelvic floor. If you think about stopping gas or trying to hold in a bowel movement, then that might be more of the back of the pelvic floor. Individuals with a vagina might like the cue, pick up a marble or pick up a blueberry. You could also do this thinking about the anal sphincter lifting. Another cue is imagine you're walking into a very cold pool of water. That works well for people with male anatomy. Also works for female anatomy. I find that one helps me. Another cue that helps a lot of my patients is imagine you're sucking up the very last bit of milkshake at the bottom of the cup. Is everyone doing this with me? So being able to use these muscles voluntarily can be life-changing. If you know how to engage the front of the pelvic floor, then you might be able to stop urine from coming out when you cough, when you sneeze, when you laugh, when you pick up something heavy, if you have that kind of control. So it's also timing and knowing how to do it and how much to do it for a given task. So if we think about this hole where the pee comes out, which connects to the bladder, a little short tube for people who have vaginal anatomy, a short urethra. If you picture that little tube like it's a telescope and you want to telescope it in, that might cue those very important muscles in layer 2 that help with closure. We can't see them. They're in between layers 1 and 3, but there's a muscle that helps close off the urine from coming out. So if we think about where that pee comes out and we think about closing that off or pulling it in, that could be really effective for a cough or a sneeze. So right now, you could even try this with me. Try a little cough and think, what is your pelvic floor doing in response to this cough? If you're sitting on a squishy surface, you might be able to feel the response, might feel what the pelvic floor is doing. If you feel it bulge or move down a lot, it's not ideal. We really want to feel that muscle group respond and contract and lift in response to that pressure change. As the pressure doesn't go away, it goes somewhere else. So we want to cough up, right? We're not trying to cough down. So if we can create some support, close and lift, and that also works very intimately with our deep abdominal wall called the transverse abdominis. They work together and we cough up. See how that feels. Another specific way of doing a Kegel is thinking about the back passage. So imagine you're in an elevator and there's one other person there, and it's just not the time to let one go. Think about what you might do. Holding everything in, that's that external anal sphincter, and that's the back part of the pelvic floor. And if we think about picking up the blueberry vaginally, we might get more perineal lift, and the perineum is that space between the anal opening and the vagina, and that's like that apex of the bowl. So that might cue a more global contraction. So there's lots of different ways we can think about the Kegel. I want you to understand how to do it in a way that helps you with what you're trying to work on. Also, think about your pelvic floor as the floor of your core, and you can use it to help you feel stronger when you lift things. So that's another way you might voluntarily use this muscle group. But don't forget, this muscle group is never resting. It's always doing something. It's always holding up your pee and your bowels and supporting your organs all day long. So it's a unique group of skeletal muscle where it has involuntary control and voluntary control. So the Kegel is a way to voluntarily activate those muscles. So our pelvic floor has different muscle fibers, just like the other skeletal muscles in our body. We have the fast twitch or the sprinters, and we have the slow twitch or the marathoners, our endurance muscles. So as a pelvic floor PT, if I'm doing an examination and I'm looking at someone's ability to close and lift and hold and do a Kegel, I want them to be able to hold a good contraction, which has good closure and good lift for 10-second holds. That would be gold standard. I would also like them to be able to do 10 quick, good quality contractions without losing quality. So if I'm going to be working out and I need my pelvic floor to have the endurance to sustain the workout and feel good, I'm going to need endurance for that. And if I want my pelvic floor to be able to quickly respond to a tickle in my throat when I cough, I'm going to need my sprinters for that.
Can you and should you eventually integrate Kegels with other exercises?
Absolutely. In fact, that's my preference from day one. My preference is to have someone understand how and when to use a Kegel functionally. Now, sometimes there's a time and a place for someone sitting in a chair and doing 3 sets of 10 and getting those connections going. And I still will give that when it's appropriate. But the highest pressure activity that most people do all day long in an activity of daily living is getting out of a chair. Fantastic article shows there is more pressure, intra-abdominal pressure, and potentially pressure on the pelvic floor with getting out of a chair than over 20 different mat Pilates exercises. So how you do that really matters. I find people do a more optimal Kegel or pelvic floor contraction at the bottom of an inhale, and they're engaging on the exhale. So if you inhale, as you inhale, that pelvic floor should drop and lengthen. And when you exhale, it should close and lift. So often people do really well engaging their pelvic floor if they exhale as they exit. And so they kind of time that exhale as they're getting out of a chair or as they're exerting, like picking up something heavy, picking up a little human, picking up a bag of groceries, something like that. So let's say you're at the gym and you want to integrate a functional Kegel into your workout. You might add in a Kegel or a pelvic floor contraction as you come out of a squat, right? So you might inhale on the way down, exhale, thinking about picking up the blueberry on the way up. One thing to look out for is if you've never done that before, you want to start slow. You might start with picking 1 or 2 exercises to integrate your pelvic floor strengthening into, because remember, these muscles, they work all day long for us. They don't take a break. So if you're symptomatic and you're dealing with leaking or dealing with heaviness and you kind of go all out and go for it, you might have more of those symptoms afterwards, and we don't want that. Or if you're that person that already holds a lot of tension in your pelvic floor, which is a lot of people that come to see us at Origin, you might really need to make sure you focus on relaxing the pelvic floor, which I think we're going to talk about soon.
We've talked about strengthening of the pelvic floor, but how important is relaxation of this area?
Oh, it's so important to know how to relax these muscles and to understand what that feels like in your body. So we do this every day, whether you know it or not. When you sit on the toilet, or even if you're someone who stands to urinate, you have to relax the pelvic floor. And then the bladder, which is a bag of muscle, contracts and pushes that urine out. So the pelvic floor has to let the urine out. It also has to let your poop out. So it's really important for bowel movements to know how to lengthen and bulge. And that's very different than straining. So I'll tell my patients pooping should not be an athletic event. We need to be able to specifically generate pressure in our abdominal wall to the back passage to get our bowel movements out. We also need these muscles to be able to relax for healthy sexual function. It allows for blood flow to get to this area. Men and women both have erectile tissue that are involved in sexual function. The vagina grows 1/3 in length during sexual arousal. It's like an accordion. And for that to happen, that pelvic floor needs to be able to relax to do that. If you have a lot of pain in this area, being able to connect to that pelvic floor and mindfully relax and lengthen those muscles can help you get out of pain. Just a simple breathing exercise can make all the difference in the world. So we talked about earlier how the diaphragm and the pelvic floor work together. So when we inhale, the diaphragm drops, the pelvic floor drops. And if you can exaggerate that with your brain and send that pressure down as you inhale, that can soften and lengthen the pelvic floor and help get you out of pain. So a few of my favorite exercises that I like to give people to connect to their pelvic floor and relax in their pelvic floor include child's pose. So if you're on the floor and you're folded forward and relaxed and you feel like you just don't quite have enough space in your hips and your knees to be comfortable there, then you might need a little extra support for that. So you might want to try a child's pose with a pillow between your abdomen and your thighs, and a pillow between your knees and your heels. If you don't feel like your knees and your hips bend enough, it should really feel comfortable. Your knees should be wide and you should be able to breathe into the pelvic floor in that position. Great position for relaxation. Another position that's great for connecting to the pelvic floor is happy baby. So as you inhale, because your legs are up against the sides of your trunk, it helps direct pressure towards the pelvic floor. And often that helps people feel that lengthening if you're having a hard time feeling it in other positions. You can also sit on a little towel and you can feel as you inhale the pelvic floor dropping into the towel. So sitting on a squishy surface or on a towel can also help you feel it. And a deep squat is another position that can help your pelvic floor lengthen and relax. You may have heard of something called a squatty potty. So when your knees are above your hips, it helps a muscle in your third layer called the puborectalis that slings around the rectum. it helps relax it. It's kind of letting the reins out of a horse, and it helps create a straight tube for that poop to come out. So putting your feet up on a stool can help bowel movements be easier, and sometimes is the thing that someone needs to not feel constipated.
What do you think women who are pregnant and women who are postpartum should know? Is it safe to exercise while pregnant and after giving birth?
So safety of exercise at any time for any individual is very person dependent. And there are some conditions that make it unsafe for someone who is pregnant or postpartum to engage in exercise at that time. So as a pelvic floor physical therapist, we work very closely with physicians and midwives to make sure that our patients are safe to engage in exercise. The good news is most pregnant humans can exercise safely. And in fact, there's so many benefits to the pregnant person and the baby, basically to maintaining fitness levels. If someone is planning to have a vaginal delivery, that's a pretty big workout that you're preparing for. So maintaining fitness, maintaining your walking volume during pregnancy, if that's safe for you to do so, can help the baby move down into the birth canal. And whether you're planning to deliver through the lobby or out the sunroof, maintaining fitness is really, really important for your recovery, because you're also going to be taking care of a human or maybe more than one human on the other side. The general guidelines for people that are pregnant is if you have engaged in that type of physical activity before, you can continue on some level. Now, that training might shift and it might look a little different as the baby grows and your body goes through changes, right? So your uterus starts off the size of a fist and it grows into the size of a watermelon. And you're also making a whole new organ that's 2 pounds called a placenta, and amniotic fluid, and 50% more blood volume. And even just sitting at rest, it's like you're running a marathon a day. Your metabolic rate doubles. And so it's really just a lot of work to be pregnant. And so because your body's working so hard on a daily basis, often we need to kind of pull back on the intensity. So you're still strong, you're still capable, but you may be not invincible. Now, postpartum, regardless of how you deliver your baby, very early on, you can start to connect to your abdominal wall and your pelvic floor to get those brain waves connecting to that system for things like getting out of a chair, which requires a lot of coordination and support. And that can make that movement feel better. And you get up and down a lot when you have a little baby that you're feeding and taking care of. But what's really important postpartum is we have to make sure that there's full gynecologic healing. So that uterus that grew to the size of a watermelon is shrinking down back to the size of a fist. And during that process, it's pushing out a lot of fluid. It's called lochia. It looks like a menstrual period, but it's different, and it can last for like 6 to 8 weeks. And there's also a big wound on the inside of the uterus where the placenta was. And so there's a lot of healing happening. The cool thing about lochia is it's kind of your barometer. Like if you do too much, if you really go after it and you're a little bit more active than your body's ready for, that starts to increase in volume. So that might be a clue that you need to scale back. Now, there's unsafe levels of bleeding, which I'm not going to get into today. But if you're bleeding excessively, you would need to talk to your doctor. But in general, you should see that nice, slow taper. And, during 0 to 6 weeks, most people feel like in the first week or two that they feel like kind of getting out of the house for a little walk. That's pretty common. And then they're usually seeing their healthcare provider, whether it's a midwife or an obstetrician, to have a postpartum check to make sure they're safe to return to other more intense levels of exercise. And so between 0 to 6, it's usually involving walking, but there's always exceptions. People who were really chronically fit for years and also maintained fitness levels during their pregnancy might move along a little bit faster. Someone who maybe had a big dip in their activity level during their pregnancy, maybe they felt sick, maybe they were throwing up, maybe they were on bed rest, they might have a different path forward. But in general, you know, the hope and all the other pelvic floor PTs and trainers and people that work with this population want to help you ultimately reach your goals and get back to what you want to do. And it might feel a little different when you do because you've been renovated. So trying to connect to that abdominal wall and that pelvic floor and easing back into whatever activity you want to get back to is going to be what's most important.
What should people know about diastasis recti abdominis, or DRA?
What a lot of people don't realize is 100% of people that carry a pregnancy to full term will have a diastasis. You have to stretch your abdominal wall to grow that human. That is part of the process. And while the diastasis is talking about the space at the rectus abdominis, at the linea alba between the two rectus bellies, the entire abdomen is stretching. It's not just that. So that's important to think about. Reducing fear is something I'm really passionate about. Seeing some coning and having a diastasis or being diagnosed with that, which is basically anyone that has a space of 2 centimeters or more between those rectus bellies, which can be measured, does not mean there's something wrong with you. Does not mean you can't do the things you want to do. Does not mean that you're not strong. But sometimes having extra space there can make things feel different. And often there's a lot we can do to help this condition conservatively. And when I see people walk in this door and they have a diastasis or a DRA and they're postpartum, like let's say they're a few months postpartum, one thing I've noticed that's really common in this population that comes to origin is they get really, really good at not using their abdominal wall. And there's probably a lot of reasons for this. So during pregnancy, you kind of have to figure out to not use it because it's stretched out, right? So muscles, if we get into muscle physiology, we have our actin and our myosin, and for them to contract well, they have to be in this nice, perfect length tension relationship. But if they're really stretched out, it makes it a little bit harder to engage those muscles, and they just aren't functioning optimally in that 9th month of pregnancy. So people have to figure out how to get out of bed by not just sitting up because you just can't do it. So that's one reason why someone may have gotten really good at not using their abdominal wall. Also, if they had a cesarean, that's a major abdominal surgery. They may have had to figure out to not use it because it hurts and that has to heal, right? Those muscles had to be cut through. It also might have to do with fear. Maybe someone told them that if they use their abs in the wrong way, that it's going to make their diastasis worse. And I find that that happens a lot. So when that person is safe and ready to use their abdominal wall, which is pretty early on at a light level, I spend a lot of time reducing fear and getting people connecting to their abdominal wall and starting to strengthen, and not just the front, but the sides and the back. So the whole trunk working together with the pelvic floor.
If people could only walk away from this video with 3 pieces of information, what would you tell them?
I would tell them, I hope you have an understanding of how to do a Kegel and when you might do a Kegel during the day, like when you cough or sneeze or get out of a chair or pick up something heavy. Those might be times you might do it functionally. I would hope you also kind of understand that it's important in how to relax the pelvic floor. And when that happens during your daily life, like sitting on the toilet, sexual activities, or mindfully breathing. And I also hope that you know to rehabilitate a DRA, you must train the abdominal wall. We have to strengthen those muscles to be able to make changes in that muscle.
Jen, where can people go to learn more about you and from you?
You can go to our website, which is theoriginway.com, and you can find me under the Brentwood location. My profile's there, and you can also book appointments online with me. I see people in person at Brentwood. I also treat people virtually. You can also find me on Instagram. I don't post that much, but Dr. Jen Carr PT. And sometimes you'll see me on our company Instagram, which is at theoriginway.com.
And if people want to find a licensed healthcare provider like you, what resources can you direct them toward?
Yeah, absolutely. It's really important. We have a number of pelvic health providers that work at Origin that you can find on our website. We have virtual care nationwide and a number of clinics across the country. So theoriginway.com is a great place to start. You can also find pelvic health providers at the APTA website. Also, website has a directory called the Pelvic Guru, and Herman and Wallace also has a directory as well.
Great. Well, thank you so much for watching. If you enjoyed the video, hit that like button, subscribe, turn on notifications, follow Jen, and if you want to see Jen in future videos and future topics, let us know what you're interested in us talking about. So Jen, thanks for joining me today.
Thank you.